Manasvi, you can start. Over to you.
Hello, namaste, and good afternoon. This is Manashvi, and on behalf of ForOptom, I welcome you all to ForOptom e-learning session. The ForOptom e-learning session is an initiative by ForOptom, and it is an interactive program. I'm so sorry. It is an interactive program where we discuss optometric topics. This session is live on YouTube, and if you have any queries, you can type them out in the conversation box, and we will be discussing them after the presentation. Today, we have with us Mr. Fakhruddin Shamsheer Barodawala, who will be speaking on the topic contact lens aftercare process. A brief introduction to our speaker here. Mr. Fakhruddin completed his graduation and post-graduation at Lotus College of Optometry, Mumbai, India, after which he pursued his career in academics and research. He is currently working as lecturer at SEGi University, involving in teaching contact lens, dispensing optics, low vision, and advanced optometry care. He was awarded Fellow of IACLE, FIACLE, and a Fellow of ASCO-India, Dispensing Optics in the year 2017. Optom Fakhruddin is also a recipient of the IACLE Travel Award for the year 2019. His clinical expertise includes fitting irregular corneas and orthokeratology. He has a few publications in the field of public health and contact lenses, and has presented several papers at national and international conferences. Mr. Fakhruddin is also conceptualizer behind OOLS, which stands for Online Optometry Learning Series. So on behalf of ForOptom team, I welcome you, sir.
Hi, Manashvi, and thank you very much for your kind introduction. And I would like to wish a good evening, good day to everybody who is attending this session. Let's get started. I'm just going to turn off my video so that you don't get distracted and dive into the topic straight away.
One quick question, sir. So you also
Yes.
host in OOLS, am I right?
Yes, yes.
So how does it feel to be a presenter from the host?
So this is a really different thing. I mean, being a host is totally different. I come in the beginning and I go off at the end. Now I'm in the middle, so I have to take care of the section which is the most important section, I would say, in terms of delivering the message.
Yes,
and I'll be happy to take any questions or any suggestions and comments at the end of the session as well. So
yes.
It's totally a different feeling, and thank you ForOptom for opening up this platform and allowing me to talk today.
Yes, sir. So we can continue with the presentation now.
Okay, so yes, today I will be going to share with you my experience and my tips on the contact lens aftercare process, because an aftercare eye examination post contact lens delivery or dispensing is very, very important. Before I begin, I just want to clarify that I have no financial disclosures for any of the products or any of the brand names which I would be mentioning. At the same time, I would like to acknowledge IACLE, because I am using some materials from IACLE for this session, as well as ForOptom for giving me this opportunity. So let's look at what are the aims of an aftercare visit. Why is an aftercare visit important? There are four very important aims, or the rules on why we should conduct an aftercare. The first one is it helps or to understand the ocular health. So we want to make sure that while putting in the lens, we are preserving the ocular health of the patient. Second is we also want to make sure that the vision is being maintained. So maintaining good vision is the second important aim of an aftercare. Followed by, we want to optimize the comfort. So if patient is wearing a lens onto the eye, we want to make sure that are they comfortable wearing those lenses or not. And lastly, we want to make sure that the lens fitting performance is satisfactory. So these are the four important aims, what you must look across when you are performing an aftercare visit. What is the flow? So I have come up with this flow, and I think I've taken ideas from various resources where these are the steps what we should follow. The first one would be scheduling an appointment and setting a reminder for the appointment. Then you have a step where you have practitioner's preparation. Patient walks in, then you do a subjective and an objective assessment, followed by lens inspection. And lastly, you would come up with your plan and advice. I'm going to go in each step in a bit more detail. So the first step involved is scheduling and reminding the patient for an aftercare appointment. So sending a simple text message reminding them on WhatsApp or via email makes a lot of difference. We need to make sure to remind our patients to come up for their appointments during the aftercare schedule appointment. And what do we need to look after the patient is we must remind them to at least wear their lenses for 4 hours, because we want to see that what happens with the lens on the eye after certain hours or wear, because that's the most important part of an aftercare eye examination. We also need to remind the patients to bring along their lens care products, which includes the lens case and their lens solution, because at the same time we are going to evaluate on how the patient is using these lens care products, how the patient is using the lens case. And not only that, but sometimes the patient has been advised to use a specific lens care product which you may not have in your clinical practice. So you want the patient to bring those lens care products so they can continue using them in front of you, because you want them to remove the lenses. The next important point is remind them to bring along their spectacles. I think this is something which people usually forget when they are scheduling their appointment, or when they are reminding the patients, or patients normally forget, because what happens is morning they wear the lenses, they go to work, they go to university, and they walk into your appointment in the afternoon. And since they are wearing the lenses onto the eye, the spectacles are at home. So that's important for you to actually remind the patients to come with the lenses on at least for 4 hours, carry along their lens care products and the lens case what they are using, and also bring along the spectacle case. So these are certain key points what I think you must remember when you schedule an appointment for the aftercare. This shows you the recommended aftercare schedule, which I have taken up from the Contact Lens A to Z by Nathan Efron. And this, I think you can follow this in a general rule on if the patient is using a soft lens, which is a daily wear lens, when should be the next follow-up aftercare. So the first aftercare should be within 1 to 2 weeks. Then you have the next, which is 1 month, then 3 months later, then 6 months, and then 6 to 12 months later. Now, bear in mind that this recommended aftercare schedule is when nothing goes wrong on each visit. You follow up this, right? When there is something which you find out during an aftercare, it will be case-based or case-to-case based what you're going to follow. So make sure that you have that in mind. And this table also shows you not only for daily wear, but if you see the second part, it shows you for the extended wear, it shows you for rigid gas permeable lenses, RGPs, and also for therapeutic lenses. So this recommended aftercare schedule is what I usually also follow. The next part of examination is again very, very important, which is the practitioner's preparation. Now, when I say practitioner's preparation, what do I mean is we must be aware as a practitioner on what the patient is already using. Probably you are the one who have dispensed or delivered the lens to the patient, or sometimes you are into a clinical practice where your fellow colleagues have delivered the lenses to the patient, but all the clinical records are available for you. So when you are conducting an aftercare visit, you must be prepared as a practitioner that you know what lens material has been given to them, material or brand, what lens parameters were prescribed or dispensed, what was the lens modality, what was suggested, what was the recommended wearing time and recommended schedule, and what lens care products were recommended and prescribed to the patient. So as a practitioner, you should be prepared on the details in the back of the mind, because it makes you confident in front of the patient. If suddenly the patient says something which is not tallying to what information you have gotten or what information you have from your previous knowledge, you know that something is not right. So practitioner's preparation is again a very important thing to look at. The next step would be performing a subjective assessment. So the most important, I would say, the chunk of an aftercare visit is doing a subjective assessment. Now, subjective assessment, I would term subjective assessment as an interview. So you have to do a proper and a thorough history taking where you understand the patient's specific complaints. You understand in detail what's going on with the patient. So normally you will start with, questions like, how are you doing with the lenses? Are you comfortable with the lenses? Start with kind of a positive side of questions. Are you comfortable with these lenses? Are you happy with the vision you are getting with these lenses? So kind of subjective where the patient would start talking up. Open-ended questions are what I prefer to use rather than close-ended questions, so that patient starts talking up and tells you about the details on what's going on. And if the patient reports any specific complaints, such as, yeah, I'm happy with everything, but I have difficulties just while driving in the night. So ask more in details about driving in the night. So is it all the time? The blur vision, what you are telling me, is it when there is too much of light, or sometimes blur vision at night? Is it because you were wearing the lenses for longer time that days? So that will help you to frame your future assessments, what you're going to perform on the patient. And also you can, in the back of the mind, think of the tentative diagnosis or plan for this patient, what you're going to come up with. Also make sure that you have questioned the patient about the wearing and replacement schedule. I know you know it from your preparation, but it is important for you to ask the patient on what is the wearing schedule, how is the patient wearing the lenses, how frequently is the patient replacing the lenses, and understand from that, is he or she following what you have told him before. And the most important chunk is also on the lens care related products and questions about that, so that you have to know what lens care products are they using. Is it the same solution what you prescribe them? Have they opened up a new bottle? When did they open up a new bottle? When did they change the lens case? How old is the current lens case? How frequently do they change the lens case? So all these questions are really, really important for you to gauge the idea of whether the patient has actually understood what you were trying to tell them, or they are doing something else. One more important thing which I would like to specifically highlight here is the medical history. This thing is something which I think most of the practitioners forget when it comes to an aftercare assessment, because we think that aftercare is just something which is, looking care of the lenses or taking into account the ocular history. But there might be some category of patients who might have developed some medical history between the gap of your lens delivery and the aftercare visit. So make sure that you have specifically asked medical history questions, which probably is very, very useful in terms of, when you want to decide to change the modality or change the lens material or something like that. So if suddenly the patient say, yeah, I have been diagnosed with diabetes like 2 to 3 weeks back, you know that, you need to take that look into account when it comes to the ocular health as well as the contact lens modality in the future. So remember to ask about medical history during the aftercare assessment. Following the interview, once you have all the details, once you know about the patient's comfort, about the patient's visual response, whether the patient is happy or not happy, or you know more in details on what's wrong with the patient, you will then proceed with the objective assessment. Objective assessment in my terms means you are going to evaluate or check the eyes, or you're going to examine the eyes. Okay, so remember the patient has come with the lenses on, so the objective test with the lens on should be performed first. So what are the tests? What I usually do is I will definitely do a vision evaluation with the lens on. The idea behind this is to take the vision which is the best corrected vision. So probably you don't start with a 660, you already know that the patient best corrected vision on delivery, or when you delivered the lens to the patient, was about 6'9", 6'6". Just start with 1 or 2 lines above the best VA, what you already know. That's where the patient practitioner's preparation comes into place. So you know the patient's background. And if required, you would go and perform an over refraction on the lens. Again, that would be a subjective thing, where you have patients who complain about vision related problems, then you would do it more thoroughly. If the patient had no complaint and the vision is good enough, your +1 test is telling you that there is no change of refractive correction, I think you can just quickly go about doing over refraction. But over keratometry is one thing which I emphasize on doing, because that gives you a good idea about two things. One is the fitting assessment, because when you look at the keratometry Myers, when the lens is on, you know how the fitting is roughly, whether the fitting is good or whether the keratometry Myers are not showing equal round and all that. Second is you will know the surface quality of the lens. So if there are any deposits, the Myers will be distorted. There'll be missing Myers in some area of the keratometry, and that will tell you about the lens quality. So manual over keratometry, I think, is a really important thing, and I would recommend everybody to do that. Once you have done that, you can go ahead with lens fitting assessment. So assess the fit on the eye, and this will tell you after 4 or 5 hours or whatever, how many hours the patient has worn the lenses, what's the fitting. So that's an ideal kind of a fitting judgment, because when you deliver the lens, the fitting what you are seeing is just maybe probably 30 minutes maximum. You want to ask the patient to wait 5 hours and deliver the lens, right? So aftercare is the time where you would put in the lens. Patient has been wearing the lens for many hours, and you are checking the actual fitting of the lens after certain hours of wear. So don't neglect doing fitting assessment. Put in the fluorescein if required in terms of RGP fitting, not in soft without fluorescein, of course. RGP, you have to put in the fluorescein and check the tear prism between the lens and the cornea, and it is very, very important. Once you have finished with the on lens objective assessment, then you proceed with the assessment without lenses off. But before doing that, you have to observe the patient on how the patient takes care of the lens in terms of lens removal. So that's the first observation you are making now, to make sure that whatever instructions you have given to the patient about lens removal is being followed by the patient or not. So after doing lens fitting assessment, I would normally just tell my patient, okay, so we have checked the lens onto your eye. Can you please help me to remove your lenses? We would like to take a look at your eye now. And I'll just sit there at my slit lamp and I will just observe. I won't utter a single word. So I want to make sure, while I'm observing, I want to make sure whether my patient goes and wash the hand, whether he takes out his solution. I will observe his case, whether the case is with the solution or whether the case does not have solution. Because remember, we have told our patient to throw off solution after each wear. So that's the kind of observation I make. I would look at how the patient removes the lens. So I'm just quiet sitting there on my slit lamp. Of course, if the patient does something very, very weird or very, very intuitive, I will stop the patient and tell, sorry, this is not the way you should do. Let me show you the better way. But to me, I would observe first and then probably comment on anything else. So that's the kind of observation I am looking at. The first observation is whether the patient's hygiene, probably the patient is washing the hand or not. Second, I would look at the lens case, whether it's empty, whether it's still there onto the case is filled with solution. And then I would look at the removal technique. Once the lenses are off, I'm going to proceed with the ocular health assessment. So I'm going to look at the cornea, I'm going to look at the lids, which are again very, very important things to look at, because make sure that you evert the lids, you retract the lower lid and check for any signs which you are not happy to look for. Papillae, follicles, meibomian gland dysfunction, and all that should be assessed. And then I'll go and put in the fluorescein dye and check for any corneal staining and proceed with keratometry after checking the ocular health. So when I'm doing the keratometry, I'm actually making sure whether the lens has changed kind of corneal curvature or whether there is any influence of my lens fitting onto the keratometry of the patient or the corneal curvatures of the patient. Now, again, you have a previous knowledge about what were the patient K readings before. Practitioner's preparation is the key. So you have the patient records. You had measured 42, 44 before you delivered the lens. And then suddenly after wearing for 4 hours, the keratometry is changing suddenly to 45, 46. You understand that keratometric changes possibly is because of the lens fitting, right? So that gives you a clue and that gives you an idea on finalizing a lot of things later on. The next test would be subjective refraction, which will again help you to make sure that the refractive status of the eye is being maintained after lens removal. So once the lenses are removed, the refraction should be same as it was before. It should not be different. 0.25 changes are acceptable, but more than 0.5 diopter changes are kind of not acceptable range. So you know that there has been some influence, probably corneal edema, we don't know. And you can look at it very, very carefully again in the ocular health. So for example, you have a patient which you evaluated during dispensing or during delivering the lens. You had a patient whose lids were looking something like this. Yes, it's a kind of red. The margins, the lid looks a bit grade 1 of a redness with some disturbances onto the surface. But suddenly the patient comes to you for an aftercare and you see this on the patient's eye when you evert the lid after 2 weeks or 3 weeks of lens wear during the aftercare. So something is not right, something is going on. Probably it's the lens modality. Patient probably is wearing the lens over time of wear, or the material of the lens probably is not suiting the patient. So you can start your thought process on what am I going to advise my patient. Similarly, you can get something like this. When I put in the fluorescein dye and I see that there is a diffuse type of punctate staining on the overall corneal surface, so I know in the back of my mind that solution toxicity or reaction to solution could be one of the major components which have been involved. And I need to plan on changing solution, or I need to plan on advising the patient on probably adding one step, or observing the patient, whether the patient is rinsing the lens properly with saline or not. Sometimes the multipurpose solution directly going onto the eye may lead to this kind of solution toxicity staining. So it all relates somewhere. Or you have a patient who was complaining in the beginning that some days I feel lens awareness. I feel that something is there and I can't really, I'm not comfortable, but it only happens some days. And then you evaluate the lens on the eye, not only on the ocular health, but during fitting assessment, you see itself that, the lens is showing you this kind of appearance. So you know that the lens is folded here. So probably you have to explain to the patient on a proper insertion technique now. So that's very important, and that gives you a lot of idea on how you are going to plan up your advice for this patient. So once we have done all of this, okay, we have done an objective assessment, we have checked everything about the ocular health, we have checked the refractive status, we have checked the lens fitting and everything. Then there is a next important part of the flow of an aftercare is the inspection. So when it comes to inspection, we inspect the lens as well as we inspect the lens care products. Now, part of this have already been done during your observation while the patient was removing the lens, right? But some part, when it comes to examining the lens, again, you might have examined the lens while you are doing a fitting assessment, but examining the lens in a dark field or putting the lens onto high magnification gives you much more idea about the lens quality, the lens surface regularity, or any defects on the lens. Sometimes the RGP lens probably is scratched too much or chipped at one point. That would be the probable reason the scratch lenses is giving rise to disturbed vision or distorted vision or scattering of light kind of a complaint when it comes to night driving and all that. So make sure that you inspect the lens thoroughly under high magnification. Uh, One key point to note here is, inform the patient what you are doing, because it's the patient's property. The patient has bought the lens. What happens if while doing the inspection by mistake, or whether there was a small crack, it cracks more? So tell the patient that now this is the time I'm going to inspect the lens. Patient is sitting in your room anyway. So just inform your patient that now the next step is I'm going to inspect your lens and look at your lens very thoroughly under high magnification to see that whether your tears and all that are getting washed out easily. Try to explain each steps and each procedure to the patient. By doing so, you are actually indirectly reminding them of what they are going to do it during their normal, normal time. So it's actually giving them a reinforcement. And the next thing, you also have to inspect the lens care product. Are they using the lens care product properly? And inspect the lens case. Now, this is the thing which normally we forget. We forget about the case. When it comes to lens care product, people are only concerned about the solution, but the lens case is utmost important when it comes to lens care products as well. And if you have prescribed any specific lens care products such as hydrogen peroxide or protein removal tablets, you also have to make sure that you are looking at it carefully and seeing whether the patient is using them properly or not. So if you look at this image, this was one of the patient who walked in wearing a cosmetic lens, and during an aftercare, we saw that there is a small ring formation there onto the center of the optic zone of the colored lens. I'm sorry because the picture is not that sharp when it comes to putting up online or putting up in the slide, but there is a small ring formation there. And what we did is we just cleaned the lens thoroughly and then the ring was gone. Okay, how did it affect the patient? This is important to look at. So when we looked at the corneal staining, when we looked at the patient's cornea, when we stained it with fluorescein, we saw that exactly at the area of the ring there were corneal staining which was seen, and you can clearly see that dot spots on there. And once we ask the patient to follow up on next day, we just prescribe some lubricating eye drops and cease lens wear. Patient was good enough. The corneas were clear. So inspecting the lens is very important, and somehow it will relate to the ocular health examination. And you will see that there are changes which you can observe onto the eye if there are any deposits or defects onto the lens as well. This is a case of an RGP lens wearer who came up, and then we looked at the lens, and then you can clearly see the fingerprint kind of deposits which you can see onto the lens itself. So there are so many deposits there which are clearly seen onto the lens. So you know that you have to change something for this patient in terms of lens care regime or lens care products so that they can get rid of all this. At the same time, you have to make sure that you call these kind of patients for probably a bit more frequent aftercare to check whether all these things are all these things are actually going off or it's still remaining there. This was one patient which we have observed during our clinics, and this was a conventional contact lens wearer who has been wearing these lenses for almost 1.5 year plus. And when we looked at on the eye, it had a very specific kind of deposit here. So a heart-shaped kind of deposit was seen. Probable reasons would be because of removal, because that's where you normally pinch the lens. That's how you normally pinch the lens. That's not where you advise the patient to slide down the lens and pinch out from the conjunctival area, not from the corneal area. But this patient has been pinching out the lens on from the center of the eye, and that shows that pinching kind of a pattern which has formed a heart shape. So once you have done with the inspection, you have all the details, you have underwent a thorough eye examination for the patient, and then you will go ahead and advise the patient on plan on how you are going to change certain things, whether you are going to continue the same way, are you going to modify anything in terms of wearing schedule or wearing time, are you going to advise the patient to change solution, when is the next recommended follow-up. So all that you are going to sum up, explain the patient about what are the findings of your today's aftercare schedule, and advise them accordingly on what steps are you going to take. So this is the whole flow of an aftercare process. The most common questions what people normally come up with is, I normally forget on when to replace the lens. So people are normally forgetful on when did I open the lens, if it's definitely a monthly disposable or a bi-weekly disposable, they are going to use the same lens for 1 month or 2 weeks respectively. So they normally tend to forget on which date did I open the lens, when is the last date. So there are certain mobile applications. I'm not promoting any mobile application here. There are many out there, but this is what I've been using for few of my patient, and the response I get from them is quite good. So this is one of the application where you key in how many days the lens is meant for. You can actually edit the number there. You can just click on this and then you can put it whether it's a bi-weekly, so you put 14 and then you just save. Once you have saved, you see, for example, this is a 30-day lens, so they have put 30 and then you click on save. Once you have saved, every day there will be notifications onto your phone coming up and asking you, did you wear your lens or did you not wear your lens. The only drawback about this application is I don't really like of about the no plus 1 day. Even if you don't wear the lens, it is considered as a day old. So what I tell my patients is, consider this reminder to it's reminding you to clean your lenses. So you never press no plus 1 day. You always press yes. If you wear, if you don't wear, you clean and you press yes. So at least it generates a reminder for the patient to clean the lens every day, whether they wear or they don't wear, right? So this is one thing which I don't really encourage or like about this particular thing. But of course, notification helps the patient to clean the lens at least. So that's an advantage. And at the end of the day, 30 days, it gives you a notification on your phone and it tells you that it's time to change the lenses. So that's the time where patients will be reminded that, okay, it's time, we are going to, I mean, I have to throw the lenses. This application is the contact lens time. It's widely available on the mobile app. Again, I'm not promoting this. There might be a lot of good applications apart from this, which probably you will know, but I'm just trying to bring in an idea that everybody is now on to digital. And if you have something like this, people would definitely benefit on knowing about this. So this is where an advice should come from you. The next query or question which people normally do have is the lens care replacement schedule. So the first was the lens replacement. How should I replace the lens? This one is the lens care replacement schedule. So there are two things what you need to understand. There are two expiry dates onto the solution, right? One is the shelf life, which is always written here or printed here. Okay. Now this means that if you don't open the solution, you will have to use it before 2021 or 2021 December, right? So this is if you don't open. Okay, but what we have to emphasize to our patients is you also have to look at this. The brands have already mentioned that if you open the bottle, the maximum duration is 90 days or 30 days. So you have to tell this to your patient that once you open, the solution efficacy is only for that particular recommended amount of days. So when you open a solution, take a marker pen, write it down on the bottle or onto the box, which date you opened up. And 90 days from there, you need to discard the solution. Okay. The next common question which we normally face is, my solution lasts for 6 months, for 8 months, for 3 months. Okay, but this is how I explain, or this is what you can now explain to your patient, that if we really sit down and calculate how much recommended solution minimum you require for each wear, I don't think the solution can last for 6 months. So when you want to wear your lenses, you are going to clean the lenses. That takes about 5 ml of your solution. When you remove your lenses, you are going to clean the lenses, and that takes again 5 ml of solution. Now this is not what I am talking. This is from a paper which was published, or it was presented in the review of cornea and contact lenses, which says that for adequate rubbing and for adequate rinsing, approximately 5 ml of solution, which is 2.5 ml per lens, should be used. So that's the numbers what I'm putting it there. And then for storage, they recommend the average case which holds 2.5 ml. So another 5 ml for storage. So the total per day use is a minimum of 15 ml. So then it's the question of mathematics. So if the patient is buying a 360 ml bottle and then you divide it by 15 ml per day, so you can do the maths, and I think you will end up to around 24 to 28 days where the patient can use the solution. So how can the patient use for 6 months or 3 months? It's not possible. It is possible only if the patient is not using it correctly. So you have to make sure, you have to explain to the patient about all these calculations and come up with a proper explanation. The next important paper or the research which was done studied the effect of, do people really care for contact lens case in the correct way? So this study looked at 745 contact lens wearers, and there were very interesting results. They found out that only less than 6% of respondents were fully compliant. So you don't have, many uh, people who are compliant. There was only 6% of them who were compliant. And GP wearers reported significantly poorer case hygiene compared to soft lens wearers. That is also very alarming. And at the same time, compliance scores were better in individual where the practitioners specifically questions about lens case hygiene. So this is why I've been focusing on the history, that you need to ask the patient about lens care, lens case included. So if you ask the patient, you see the study says that the compliance rate was better in individuals or in patients where the practitioners specifically asked about the lens case hygiene. And whereas with a more frequent aftercare, or where the practitioners went on to explain the consequence of poor lens case hygiene had better compliance. So we as practitioners have to take a step forward during the process of delivery. You have to explain to the patient the importance of aftercare, the importance of proper use of solution, the importance of proper use of lens case. One more study which was very interesting, which I found, and it studied the contact lens and lens storage case cleaning instructions. Whose advice should we follow? So there had been a bit of dilemma where recommendations from different organizational bodies were different. The thing printed on the solution was different than the thing which practitioners recommend. I would say that's a bit of an advantage as a practitioner, because we as practitioner have the upper hand, and we can tell them that, you see, we are looking at your eye, we know what's best for you, we have been looking at your ocular surface, and this is how we want to recommend you to have the appropriate lens care regime. So the study stated that the results said that lens cleaning instructions were inconsistent and limited recommendations about the drying position, the rinsing, and the rubbing of lens case. This is something to look at, because we forget that these instructions are important to be delivered or to be given to our patients. So make sure that you correctly explain to them. You have to put the lens case upside down, air dry it, and rinse with the multipurpose solution. Clean with multipurpose solution, sorry, and rinse with the saline, and put it upside down. So when you have this kind of problem, you can actually come up with your own recommended kind of leaflets which you can give to your patients, so that they have these leaflets stick up onto the wall, where on their dressing table, so that they are aware, oh, I have done all these steps or not. Washing hands, cleaning the lens, throwing off the solution, rinsing the lens, and all that. So these kind of leaflets, I have taken it from the BCLA and AOCLE website, but you as practitioner can come up with some small, constructive, easy to read, easy to see kind of instructions which you can give to all your contact lens wearers. The other study which I looked at was on studying the contact lens user profile, the attitudes and the level of compliance and care. And this is not to a surprise, where we know purchase of lenses via the internet was associated with lack of awareness of aftercare visit. So that is the reason it is important for us to explain to our whoever walks into our practice the importance of aftercare, the importance of why you should get an eye test before you buy the lenses, the importance of aftercare to be done after you deliver the lenses. So this was a publication which was done in 2010, and it says that the awareness of aftercare was associated with internet purchase of lenses. So our role as practitioner is really, really important. And this is how you can rejuvenate the aftercare process. Again, this is a recommendation by a publication, or by, I would not say it's a publication, but it's a recommendation by J&J Vision Care Company, and it's come out with this optimum kind of a rejuvenated aftercare, where O stands for the opportunity. Recognize what's the opportunity, and you start with a correct attitude. You look at what's the patient complaint is, and then follow with P, which is the patient contact lens wearing experience and expectations of the practitioner. So you look at each step in detail, go in for a tailored clinical investigation, because again, every time when the patient come in, you do the same things again. Sometimes you might just keep doing an over refraction as if the VA is good, or something like that. You need to tailor made it. You probably need to sometimes add on one of the tests which you didn't do it last time. For example, doing a tear scope, looking at the tear quality properly, doing a K5, measuring the tear status very efficiently if you have the instruments there. So tailor the clinical investigation, go on for new technologies, be innovative, advise the patient if there is any recommendations to be made. If you think that, looking at the ocular health and looking at everything onto the eye, you feel that the patient needs some professional recommendation of changing the material or the lens care products, go ahead and make a professional recommendation. Take immediate action, undertake immediate action, which is you, and try to refit on the same day so that the patient can experience the difference. Okay, and make a difference in each and every aftercare. Don't be the same, come up with some new things which you can explain to the patient, you can advise to the patient. And of course, the important things are definitely to be told. You need to keep reminding your patients about hygiene and everything, but make sure there's something more towards it. And this is a very latest review article which is in the clinical and experimental optometry, which has been titled on rethinking contact lens aftercare. And it's a very detailed article which I reviewed a lot of papers. But I think the key important point is the aftercare is very, very important. That's what they have mentioned. And they came up to a conclusion that whatever the case may be, whatever the lens you have dispensed to your patient, you must make sure as a practitioner that the first aftercare visit should always take place within the 1 or 2 weeks of lens dispensing, because this is the time where you are actually going to finalize everything and you are actually going to look at the ocular status, whether the lens has created any problems or not. So, and recommended schedule has also been given, so probably you would want to follow this as well. But the key point here is, the key part here is the first aftercare visit should always be done within 1 to 2 weeks of lens dispensing. So that's very important. And aftercare is an ongoing patient care. So this is, again, as a practitioner, you must make sure that this is in the patient's head as well. So they know that when they are going to buy contact lenses, they have to return for aftercare, and they know it's an ongoing care and they should come back. So with this thought, I leave you all. If you have any questions, I'll be happy to take questions.
Thank you. So that was a wonderful presentation, and I'm sure that our audiences have also immensely enjoyed it. So we will be moving on towards the questions now. We have received quite a few questions.
Yes,
So will you just give me a moment?
no
Yes.
problem.
So we have a question from Miss Ankita, who wants to know that will there be any effect on contact lens patient if they are under any medication, and can they continue wearing contact lens or not?
They can definitely continue wearing contact lenses, of course. Now, when it comes to what kind of medications are you talking about? So let me go into that particular aspect. If there are any topical eye drops which they need to be putting it onto their eye, for example, if they are under any glaucoma medication, we would recommend the patient to put in the drops first. Once the effect of the drop has gone, probably about 10 to 15 minutes is a good and a safe time, and then put on the lenses. So that's the topical part of it. If they are taking any systemic drugs, for example, if they are taking tablets for diabetes and all that, I think the drugs directly won't affect the lens wearing, but you must make sure that the patient is free from any ocular effects of that particular systemic disease. So doing an ocular health examination would be an ideal thing before you choose the lens for the patient. So I hope that answers her question.
Similarly, the next question is from Mr. Robin Thapa, who wants to know why should RGP lenses be kept in the solution after removal, and what will happen if we do not do that?
So currently the lens materials are recommended to keep in the hydrated state. And if you don't hydrate it, or if you don't keep it in the solution, it might undergo some contact lens, the parameter changes, and you don't want that to happen. So the ideal recommendation is putting it in multipurpose solution for one, dimensional stability, two, making it to be disinfectant because you are using the solution overnight. So the lenses are getting disinfected. So I think that's important. Even before delivery, even before you are delivering an RGP lens, when you receive the lens, they are in the dry state most of the times. It is recommended that you soak the lenses overnight in the multipurpose solution before one overnight before you are delivering the lens. So that's again very important. It should be hydrated for two reasons. One is the dimensional stability. Second would be the disinfection part.
Similarly, the next question is what is FSK and why is it important to perform during aftercare?
So I think FSK is front surface keratometry. The importance of doing front surface keratometry, I assume the attendee is asking with the lenses on. So as I said, putting on, doing keratometry with the lenses on is really important to check. One is the surface regularity. You can come to know whether if there are any deposits, the surface of the contact lens is regular or not. The tear distribution onto the lens is regular or not, because if the tear film on top of your contact lens breaks very easily, you know that the surface is very smooth and something has to be done. The second thing is you can also get an idea about the fitting of the lens. So I think it's more towards surface regularity, more towards surface defects of the lens. That's why you do front surface keratometry during an aftercare.
Next question is again from Ms. Ankita Mishra, who wants to know if a patient wants to order contact lens, but if we do not have a contact lens trial set in keratometer, so how do we dispense the contact lens depending on refraction number?
If you want to do contact lens practice without keratometry, it's ideally I don't recommend or encourage doing that. You need to have a baseline keratometer or keratometry reading, not only because you want the corneal curvature, but it also helps in future monitoring whether there is any changes in the corneal curvatures. That's one. So if you want to based on the empirical fitting, so if you don't have a trial lens with you, the standard curvatures are there. You have 8.5, 8.6, 8.4. Again, don't quote me. I don't recommend you doing this without keratometry because we need to understand the corneal curvatures before even you put the lens in. So if you can put in a standard curvature, probably an 8.4 and an 8.6, judge the fitting assessment and then go about finalizing. That could be one of the options, but again, it's not recommended. So having a keratometry reading is definitely an important thing.
Similarly, next question is from Ms. Simran. So she asks, how do you counsel a severe dry eye patient who wants to go for contact lenses?
So dry eye patients understand one thing, they are not a contraindication for contact lens wear. That's the one of the misconception I think people do have, that dry eye patients cannot wear contact lenses. I don't think that is the case. Dry eye patients are to be looked at very carefully in terms of lens material selection. So as if you as a practitioner select a proper lens material and a lens modality, I think they are also a good candidate to put on the lens. So don't think that you can't fit a lens on a dry eye patient. You can definitely fit a lens on a dry eye patient. The only thing is in terms of materials, in terms of lens design, you have to be a bit more different. So probably you want to go for low water content lenses, thinner lenses, and recommend those shorter wearing time. So again, it comes back to why the patient wants to wear the lenses. So when we look at that history on when you want to put in lens to the patient, the first thing you do is a history taking, where you ask the patient about the purpose of lens wear. So understand that purpose. If the purpose is just for socialization, I mean, wearing shorter duration hours could solve their purpose. Or if you can put in an RGP lens, severe dry eye, you can also put in a scleral lens. So I think there are options available, don't think that dry eye patients are not suitable candidates for contact lens. I think that's what I would like to say.
Similarly, the next question is from Mr. Harry, who wants to know what is the ideal follow-up we have to recommend to the patient in case of using things like enzyme cleaner or hydrogen peroxide system.
There would be no difference in terms of follow-up. I recommend normal follow-up. The first follow-up, I would normally recommend the patient to come back within 2 weeks, the first aftercare. And then I would follow up the patient 1 month, 3 months, 6 months, and so on. But if you find any defects in terms of lens quality, or that's why you have deposit, that's why you have prescribed hydrogen peroxide, you probably want to see the patients a bit more frequent. So probably after 2 weeks of follow-up, you do a next week of 2 weeks of follow-up back again to check whether your introduced new way of aftercare has helped the patient or not. So it totally depends on what intervention you're doing. And if you are doing any intervention, whether it's an enzyme cleaning tablet, whether it's a change of solution, or whether it's giving hydrogen peroxide, you would want the patient to be seen frequently. So I would do a 1 week or a 2 week follow-up in that case. And then if nothing else on the 2 week follow-up, 1 month, 3 months, then the sequence continues.
All right. So next question is regarding Acanthamoeba keratitis. So if we use tap water, the tap water uses significantly increases the risk of Acanthamoeba keratitis infection.
Yes.
So our audience here wants to know that is it similar? Is there still a risk when you wash your face with tap water while the contact lens is on?
Of course, definitely. I would never recommend that. You mean the question is whether the lens is on and I wash the face?
Yes. So how high is the risk of Acanthamoeba keratitis, or is there any risk at all?
I think there is always a risk because we are scared of the water going on inside the eye. The problem is it's not the water going inside the eye. It may be trapped between the lens and the cornea, and that stagnant water can create a lot of problems. So if you ask me, I would not recommend that in any way.
And how do we differentiate between a contact lens induced dry eyes and pathological dry eyes?
Uh, Again, a very good question. There is a contact lens induced dry eye or contact lens associated dry eye, or a dry eye as a dry eye without lens. So the name itself suggests if you have the baseline, so when it comes to preliminary examination of the patient, you are going to measure the tear meniscus height and the TBUT, which is the tear breakup time, before you put in the lens. And you are going to measure that during your aftercare. So you have two values. You have before the lens and you have a value which is after the lens. That will give you an idea on whether the tear stability is being affected. And that again relates to the symptoms of the patient. So the patient would complain, previously when I was not wearing the lenses, I didn't feel that much of a dryness, but now since I'm wearing these lenses, I am feeling a bit more dry in my eyes. So that would symptomatically also tell you that contact lens is one of the causative factor.
Thank you, sir. We are now wrapped up with our questions. And on behalf of ForOptom team and our audience, I would like to thank you, sir, very much for giving us the time and the knowledge and the lovely experience of the presentation today. So we would like to ask you to share your experience today on the session.
So thank you very much. I mean, I would like to thank the attendees and the ForOptom team for creating this wonderful platform where I mean the knowledge is spreading across, and this is the time where we can do all of these things where you can get on people to talk and we are sharing knowledge. So this is a sharing knowledge kind of a session. And thank you and keep doing what you are doing. Thank you to the attendees as well for your wonderful questions. And if you have any more questions, you can email me onto my email ID, which is on the screen. Thank you very much.
Thank you so much, sir. And indeed, as you said, this is the right time where we can learn more. We can do a lot of things. We have
Yes.
a lot of time on our hands, and we need to utilize it. On that note, we are arriving at the end of this session. I would also like to thank our audience for being so supportive, interactive, and attentive. And we will be back with more programs and sessions. Meanwhile, please like the video, subscribe to our channel. You can also visit us at www.foroptom.com and also follow us on social media, Facebook, Instagram, and WhatsApp. You can also go watch the videos that Sir uploads in his channel, which is OOLS. And so would you like to say something about that?
Thank you very much. But I think everybody is doing something or the other. So yeah, you can definitely go and watch the YouTube channel, which is on SK Optics, which is the online Optom learning series portal. And you are free to join in with us as well, because I think most of the sessions of ForOptom and online Optom learning series don't clash. So you can actually attend both the sessions and get more information and knowledge.
Thank you so much, sir. So, on this note, we're going to end the session. Stay home, stay safe, keep learning, and have a good day. Thank you.
Thank you very much. Bye bye.